Hi, it's Dr. Sweeney here today to talk about cardiovascular disease, in particular ischemic heart disease. Ischemic means when there's a lack of blood supply getting to the heart muscle, and this can manifest itself in the form of angina, which is a symptom. And angina is typically a central chest heaviness, a pressure, or a very widespread heaviness, often associated with breathlessness, dizziness, sweating, nausea, which can typically occur on exertion and is reproducible. And this is caused by narrowing or blockage of the arteries which supply the blood to the heart itself. They're the coronary arteries. There's a left and right coronary artery. These arteries can become blocked by cholesterol-filled plaques. Cholesterol is a fat that can circulate around our bloodstream, and this process is speeded up by having high blood pressure, being a smoker, being overweight. And what can happen is that gradually coronary arteries block up and they narrow. This can start to restrict blood flow to the heart muscle at times when you are demanding more from the heart, so during exercise. And it manifests itself as breathlessness, because the heart is not able to work hard enough to get the oxygen around our body, so our respiratory rate increases, so we feel more breathless. We can have this central chest heaviness, which can radiate up into the neck, down the left arm typically, and can be alleviated by rest, but is typically reproducible. That's what we call stable angina. Now, unstable angina is when those symptoms happen, but you're just at rest. And that can indicate that you are at risk of having a heart attack, what we call a myocardial infarction. So myocardium is the medical term for heart muscle, and infarction is the medical term for when there is a cessation, a stoppage of the blood supply to the heart muscle or to any body tissue. So the blood supply stops and the tissue starts to die. And so that's what a myocardial infarction is, otherwise known as a heart attack. So, as I say, often people can present with a variety of different chest pains, but it's important to note that cardiac chest pain, heart-related chest pain, is typically this widespread heaviness, pressure on the chest, which can radiate up and across to the left side, but is often triggered by exertion or becoming anxious or agitated or worried. If you are having symptoms like this, I'd really encourage you to go to your doctor to have your blood pressure and cholesterol checked, to have further investigations into the heart if necessary. Because if there is significant coronary artery disease, then things can be done to help it, including medication, so blood pressure lowering medication, blood thinning medication to prevent blood clots from blocking arteries, medication to control and lower the rate and rhythm of the heart if necessary. And there are and medication to lower cholesterol, I should say, as well. Now, they can all be used as preventative measures. There are also surgical procedures which can be undertaken, some minimally invasive, which mean that they just literally go in through the artery in the wrist or the groin. They can put a guide wire into the heart and literally use a tiny balloon to stretch open the coronary artery and leave a scaffold, a net framework, a metal framework in place to hold the artery open, and thus establishing good blood flow to the heart muscle again, preventing any kind of unstable anginal symptoms, preventing worsening symptoms on exertion, so it can improve quality of life for people that have heart disease. Beyond that, if it's more complex, there are more coronary arteries involved, more branches of the arteries involved, I should say, then sometimes they look at bypass grafting, where they literally take a bit of vein, often from the arm or leg, reverse it and use it to bypass around a narrowing so that the blood supply can get to the far distal end of the heart muscle, and that can have dramatic effects in extending people's lives and improving their exercise tolerance. So when they're trying to exert and walk and be busy, that they can start to then do that again like they used to. So that's what you call a coronary artery bypass graft, or a cabbage procedure. So all these things are available. So what I would say is, if you are someone that is having these symptoms and you're concerned about it, you should definitely go and have a chat to the doctor about getting these things investigated. They use different tests to investigate the heart, what they call an angiogram, which is when they can put dye down the arteries to outline them, to literally see if there are any narrowings. This can be done either directly or through a CT scan. They also use a treadmill test where people walk on a treadmill to strain the heart, or if that's not possible, MRI scanning to use chemicals that strain the heart and can see if there's any influence on or any effect on the blood supply to the heart muscle. So there's lots of ways of testing for this particular problem, and there are lots of potential solutions as well. So if you are concerned that every time you try to go for a walk and you're becoming increasingly breathless, you're having a central chest heaviness, you feel a bit breathless and dizzy and sweaty, then you must go and get that checked out as soon as possible. Hopefully that's been helpful. Until next time, stay healthy.